The Victorian Government acknowledges Aboriginal traditional owners of country throughout Victoria and pays respect to their cultures and elders past, present and emerging.
We all want to keep our children safe.
No matter how old or young they are.
It's a good reason to do a first aid course.
So we can help our kids and others if they need urgent care. Young children can need first aid, so this video covers the common health emergencies for children aged 1 to 5, what to do if they happen, how to get help by calling 000, how to perform cardiopulmonary resuscitation, or simply CPR, and how to learn more about first aid.
The most common causes for toddlers and young children to go to hospital include illness, choking, cuts, poisoning, burns, near drowning, sleeping accidents, driveway accidents, and there are many more. They can all be serious, even life-threatening, so time is critical. Knowing what to do and doing it straight away gives a child the greatest chance of surviving.
In an emergency, call 000. Calling for an ambulance could mean the difference between life and death. However, people sometimes hesitate to call because they are not sure if the situation qualifies as an emergency. If in doubt, always call 000. The people who take your call are trained to help you and will direct you to the appropriate resources. An immediate life-threatening emergency for a child can include burns, serious accidents or trauma, severe bleeding, difficulty breathing or no breathing, and unconsciousness. The 000 operator will ask,
Police, fire or ambulance?
if you are calling from a mobile, they will ask which state you are calling from so that you can be connected to the right 000 service. The 000 operator will then ask you 2 questions. Where is your emergency and what is your emergency? Try to be as clear and correct as possible in your answers.
I'm at 802 High Street, Shepparton, Victoria. My child isn't breathing.
As soon as the operator knows where you are and what the emergency is, they can start to send the right kind of help. They will ask you some other questions too, so they can pass on the clearest possible information to the emergency responders. It may seem like the operator wants too much detail or it's taking too long, but they are highly trained and know exactly what to ask you. Responding to them won't slow down the emergency response.
If a toddler or young child is unconscious and not breathing properly, they need CPR. First, look for the source of any danger. Make sure you and the child are safe from it. Now, check for any response from the child. Speak loudly or squeeze their shoulder.
Can you hear me? Can you hear me?
If there is no response, call 000 or get someone else to. Don't leave the child unattended. The operator will give you over-the-phone CPR instructions for you to follow until the emergency services arrive. Check if the child's nose, mouth and throat are clear. If not, remove any blockage such as vomit, blood, food or loose teeth. Then gently tilt their head back and lift their chin. Is the child breathing abnormally, grunting, gasping or not breathing at all? If they are breathing normally, move them into the recovery position and stay with them. If the child is unconscious and not breathing normally, start CPR as soon as possible after calling for help. CPR consists of 2 actions, chest compressions and mouth-to-mouth. Lie the child on their back and kneel beside them. To carry out chest compressions on a child, place the heel of one hand on the lower half of the child's breastbone, in the middle of their chest. Position yourself above the child's chest. Keeping your arms straight, press down on their chest by 1/3 of the depth of their chest. Now, release the pressure. Pressing down then releasing counts as 1 compression. To give mouth-to-mouth to a child, open the child's airway by placing one hand on their forehead or top of the head and your other hand under the chin to tilt the head back. Pinch the soft part of their nose closed with your index finger and your thumb. Open the child's mouth with your thumb and fingers. Take a breath and place your lips over the child's mouth, ensuring a good seal. Blow steadily for about 1 second, watching for the chest to rise. After the breath, watch for the child's chest to fall. Listen and feel for signs that air is being expelled. Maintain the head tilt and chin lift position. Take another breath and repeat. If the chest does not rise, check the child's mouth again and remove any obstructions. Make sure their head is tilted and chin lifted to open the airway. Check that your mouth and the child's are sealed together and that their nose is closed so that air cannot escape. Take another breath and repeat. Give 30 compressions followed by 2 breaths, which is known as 30 to 2. Aim for 5 sets of 30 to 2 in about 2 minutes. If you can't give breaths, doing compressions alone without stopping could still save a child's life. Keep going with 30 compressions, then 2 breaths until the child recovers, that is, they start moving, breathing normally, coughing, or talking, then put them in the recovery position, or first responders arrive and take over. Remember, keep going. If you can't give breaths, doing compressions only without stopping could still save a child's life. Any attempt at CPR is better than no attempt at all.
First aid isn't just for simple injuries like cuts and scrapes. If there's an emergency, first aid can mean the difference between life and death. So it pays to have first aid skills because it will make dealing with an emergency easier.
Consider taking a first aid training course and follow up with a refresher course every 3 years. There are many providers of first aid courses available in Victoria. Check with your midwife, your GP or your maternal child health nurse for details, or go to betterhealth.vic.gov.au.
More child health and safety information is available from raisingchildren.net.au, kidssafevic.com.au and rednose.org.au.
In an emergency, knowing some basic first aid could help you to save a life.